Rycontis is a combination medication used to treat symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis and bronchitis. It contains dextromethorphan, which helps to reduce the urge to cough, decongestants to relieve stuffy nose symptoms, and antihistamines to relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. Always consult with your doctor or pharmacist before giving this medication to children. Additionally, this product does not cure or shorten the length of the common cold and may cause serious side effects if not used properly. Follow all dosage directions carefully and do not use this product to make a child sleepy. Be sure to ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Rycontis, make sure to carefully follow the directions on the product package or as directed by your doctor. Take it by mouth with a full glass of water, and if you're using the liquid form, use a medication measuring device to measure the prescribed dose. Don't use a household spoon. If you're taking the extended-release capsules, swallow them whole and don't crush or chew them. If you're taking the chewable form, make sure to chew it thoroughly before swallowing. The dosage is based on your age, medical condition, and response to therapy. If you're taking this medication for allergy or hay fever symptoms, take it regularly to get the most benefit from it. And remember, don't increase your dose, take it more often, or use it for a longer time than directed. If you have any questions or if your condition lasts or gets worse, consult your pharmacist or doctor. Some common side effects of Rycontis may include drowsiness, dizziness, headache, blurred vision, upset stomach, nausea, constipation, or dry mouth/nose/throat. To alleviate dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to drink plenty of fluids unless directed otherwise by your doctor to prevent the drying up and thickening of mucus in your lungs. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. Remember that the benefits of using this medication outweigh the risks of potential side effects. However, if you experience serious side effects such as mental/mood changes, ringing in the ears, trouble urinating, weakness, easy bruising/bleeding, or irregular heartbeat, contact your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you experience any other effects, it's crucial to reach out to your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Before taking Rycontis, make sure to inform your doctor or pharmacist about any allergies you may have. It's also important to discuss your medical history, especially if you have any breathing problems, diabetes, eye problems, heart problems, high blood pressure, kidney or liver disease, seizures, stomach/intestinal problems, overactive thyroid, or urination problems. This medication may cause dizziness, drowsiness, or blurred vision, and using alcohol or marijuana can intensify these effects. It's important to avoid activities that require alertness or clear vision until you can do them safely. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this medicine. If you have diabetes, alcohol dependence, or liver disease, be cautious when using the liquid form of Rycontis as it may contain sugar and/or alcohol. It's also important to inform your doctor or dentist about all the products you use before having surgery. Older adults may be more sensitive to the side effects of this drug, and children may experience agitation/excitement instead of drowsiness. If you are pregnant or breastfeeding, discuss the risks and benefits of using Rycontis with your doctor. It's important to be aware of potential drug interactions with Rycontis. This means that it could change how other medications work in your body or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, don't start, stop, or change the dosage of any medicines without your doctor's approval. Be cautious when taking certain MAO inhibitors with Rycontis, as it may cause a serious and potentially fatal drug interaction. It's important to avoid taking specific medications during treatment with Rycontis, and most MAO inhibitors should not be taken for 2 weeks before and after treatment with this medication. Always consult your doctor about when to start or stop taking this medication. Rycontis may also interact with antihistamines applied to the skin and other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, and other antihistamines. It's crucial to check the labels on all your medicines and ask your pharmacist about using those products safely. It's also worth noting that Rycontis may interfere with certain medical/lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you use this drug. Always consult with your healthcare provider for the best time to take this medication and the appropriate daily dosage. If you suspect an overdose or experience serious symptoms such as passing out or difficulty breathing, seek immediate medical assistance by calling 911 or your local poison control center. Symptoms of overdose may include agitation, confusion, flushing, hallucinations, large pupils, muscle twitching, seizures. In children, excitement may occur first, and may be followed by loss of coordination, drowsiness, loss of consciousness, seizures. If your doctor has prescribed Rycontis for you, it's important to follow their instructions and not share the medication with others. Make sure to attend all your medical and lab appointments as directed. This will help your doctor monitor your progress and make any necessary adjustments to your treatment plan. Rycontis is typically taken orally, with or without food. The dosage and frequency of use will depend on your medical condition and response to treatment, so it's important to follow your doctor's instructions closely. It's best to take Rycontis at the same time each day to help you remember and maintain a consistent level of the medication in your body. If you have any questions or concerns about how to take Rycontis, be sure to talk to your doctor or pharmacist for more information. If you are taking Rycontis on a regular schedule and forget to take a dose, take it as soon as you remember. If it is close to the time of your next dose, then skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. Remember to always follow the recommended dosage and timing for the best results. When it comes to storing Rycontis, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a place that is not the bathroom and refrain from freezing the liquid forms of this medication. And of course, always keep all medications out of reach of children and pets. When it's time to get rid of any unused or expired Rycontis, be sure to dispose of it properly. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard the product. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.